Welcome to the Bright Eyes Podcast, advice for healthy vision for all ages. Your hosts are Dr. Naponia Warford and Dr. Beth Knighton, two optometrists who really see eye to eye. They can help you get perspective of the latest visual scientific evidence for improving your vision and helping you keep your eye on the ball. We have real facts and aqueous humor without making spectacles of ourselves. And don't worry, the jokes don't get any cornier than this, we promise.
Hello, this is Dr. Nate, and this is the first international episode of the Bright Eyes Podcast. Today's episode is all about color deficiency and EnChroma lenses. And I have a special guest. His name is Dr. Jeff Goodhue, and he practices at Abbey Eye Care in Toronto. Well, outside of Toronto. Where exactly are you, Jeff?
I'm in a suburb, I guess, a small town called Oakville. We're about half an hour outside of Toronto.
And in my understanding, you were the first practice in Ontario to provide EnChroma lenses. We were also the first in Florida.
Okay. Yeah. So Ontario is a province, Florida is a state, so they're just, similar entities. Ontario is probably 15 million people, and we were the first retailers. And the demand for this product has been huge. I think a lot of color vision or colorblind people out there have known about this product.
Absolutely.
And of course, it's sold from the US. So here in Canada, people were, a little bit leery about ordering something online. What if it didn't work? So there was this huge pent up demand in our area. And once we flicked the switch and went live, we had all these people phoning and emailing and stopping by. It's been crazy. It's been good. It's been awesome.
Yeah, EnChroma is one of those things that I had been following for quite a while, and I had talked to other doctors, and I had heard great things. And I really am thankful that you took the time to talk to us about color vision and what EnChroma is. And I think this will be a great conversation. So, Jeff, let's just start off with the basics. When we say somebody is colorblind, or we say they have a color vision deficiency, we don't necessarily mean that they see the world in black and white, but they may see color differently than other people. When you see somebody in the exam room who has problems with color vision, how do you explain that to them?
Right. So patients think of it as color blindness. That's the term that they've heard. And like you, I'm not a huge fan of the word colorblind because people think, they're going to see in black and white. I kind of change the conversation and say it's more color confusion. So certain reds and greens are going to look kind of a muddy brown, so they're going to think red and green are the same. So I try to frame it as color confusion. Your color palette is not as big as other people, because color blindness carries kind of a scary connotation for people. At least that's what I find. I try to turn it into something that's not as scary as that.
Yeah, I agree, and I think that that's a great approach. I also think it's actually more accurate, even though the term colorblind is what people usually use as shorthand. I think your color confusion term is a great way to approach it. I have two practices, one that's for all ages and the other one is exclusively for kids. And so often I'm the first person to do an eye exam for these younger patients, and I'm definitely the first person to detect color vision problems. And so it comes down to educating them about school and occupational options and other factors. I'm not exactly sure when you graduated from school, but you went to Waterloo, one of the two optometry schools in Canada, if I'm correct.
Yes, yeah.
And when I was in school, there weren't a lot of options for people who had color vision problems. We took a lot of classes and we learned a whole lot about how your eyes work and how we see color, but in terms of what we could actually offer patients, there weren't really a lot of options. There is something called an EnChroma lens where you wear a colored lens in one eye and it helps people detect colors that they might not normally have seen, but it wasn't really a very natural or helpful option.
No, exactly. The EnChroma lens was a contact lens that you could wear in one eye. It was deep red, so cosmetically it looked a little strange, but all it did was allow certain people to pass some of the standardized color vision tests, so maybe they could get into the police force or become an electrician or a commercial pilot, so they would wear this lens just for that color vision test and then never wear it again. This is the first product that's out there that can actually enhance a person's, quality of life.
What I've observed about EnChroma is, unlike the EnChroma lens, you can't get patients to take them off.
Yes, they become even though they're tinted, they become their full-time glasses. Agree completely.
Yeah, there was a patient who just happened to be the husband of one of our staff members, and the first day that we got EnChroma, he had come in for his eye exam. So he put on the EnChroma fit over testing glasses and he went outside, and it's Florida. So we always go outside and look at the plants and the flowers and look at the building.
Yeah, stop rubbing it in. The flowers are just starting to come out as we record this.
Well, well, good. Yeah. But it's something that really helps them see the subtle differences between the bright leaves and the more orangey ones and the green. And he was really excited about being able to see the different colors. And he actually took those fit overs with him. And we had an event where we were going to, as a staff, go to the Tampa Bay Lightning game. And I saw him later that day, and he wore them the whole game. And now he's got his own prescription pair, and he wears them all the time. I never see him without him. You know, he really likes them. But I think we're getting a little bit ahead of ourselves. We've mentioned EnChroma several times, and these are glasses that people can wear. They can get them in their lenses, their prescription glasses in different frames. But why don't you talk just briefly about what they are and what they do?
Yeah, so I think we need to back up a little bit and go back to your first question about, what is color blindness? So I think for the layperson, we've got 3 color receptors, I guess, at the back of the eye in your retina, sort of a blue sensor, a green sensor, and a red sensor. And normally, with folks who have color blindness, the lights, the colors that the red and green receptors can pick up, they overlap. So they don't get that differentiation between the reds and the greens because those 2 sensors aren't doing their jobs the way they should. And with the EnChroma lens, it's got special filters that knock out very specific wavelengths or very specific colors of light. And what that does is it now separates what the green and red receptors can now detect. So it makes them more kind of a normal, what a normal color vision person would see. So yeah, these lenses, they're tinted, so they look like normal sunglasses, but they're much higher tech than that. They're blocking very, very specific colors that allow those color sensors at the back of the eye to do the job that they're normally supposed to do.
Yeah, it's really elegant because I think that if you just look at the lenses themselves, they look like sunglasses, but it's so precise and so specific when they're filtering out that muddy, confusing overlap that you're talking about. You need some pretty sophisticated equipment to see the specific frequencies that they're filtering out. You wouldn't necessarily know what they're doing if you just look at them.
Yes.
It's interesting because our brains are fascinating things. And, in my experience, when I go outside with patients and we're talking with them and they're looking around and everything, it almost never works instantaneously. It does take them a few moments to sort of compare and contrast and sort of realize what's going on. And then they get kind of quiet. They get that sort of smile and their mouth kind of drops a little bit. And then they'll say, like, oh, I thought this was that color, or now I realized it's a totally different color. I see this whole pattern of things going on.
I would agree. We've had a couple of those kind of, over the top internet YouTube moments, but most people, it's almost like sensory overload. They put the glasses on and they get to see these things for the very first time, and their brain, their eyes they're just overwhelmed. They really don't know what to do. So they kind of go quiet, like you said. It's almost like their demeanor changes, and some of them start to get excited. Some of them get quite emotional. So we try not to, hover over them and say, what color is this? What color is that? We just let them absorb, just experience it, because it's, we take this for granted. For them, it's completely new. And we just, like you, I just like to stand back and just watch the reaction. Each patient's different, but you're right. It doesn't get old. It's super fun to be part of that.
The closest thing I think I've ever experienced to that is we provide vision therapy for a range of visual problems. And I've worked with patients who've developed 3D vision for the first time in their life. And when they're trying to take it all in and they're looking around and they're trying to make sense of the things that they see, it's just really cool. They don't always have words to describe what they're experiencing. And it really is an interesting thing.
Yeah. I mean, we had a patient probably 2 months ago who drove about 90 minutes to come to our practice. He came in with his wife. And I don't know if you found this, but they never come in by themselves, ever.
Right. It's often the whole family, but it's usually at least a spouse or a brother.
Yes, exactly. So that, it's kind of a big outing for these folks when they come to our practice. And this gentleman put the glasses on, and for 25, 30 years, the number of years he'd been married to his wife, he thought her eyes were blue. And they actually weren't blue, they were hazel. So they had, brown with a bit of green in it. He just couldn't see the green. So for the first time ever, he could see the true color of his wife's eyes. And that was emotional for, everybody in the whole office. So he ordered a pair of prescription EnChroma because he needs a prescription. So that takes a couple weeks to come in. So this was on a Saturday. Tried the glasses on, loved them. Monday morning, he drives all the way back to our practice, another 90 minutes, so 3 hours both ways, just to try the fit overs, just to try the samples again. He knew his glasses wouldn't come in for another couple weeks. He just wanted that experience again. And then 2 weeks later, his glasses came in, and we called him, and it's like he was sitting by the phone. 90 minutes later, he was there. Like, this guy's so excited, and like the others, the spouse of your staff member, his patient hasn't taken them off. They've become his regular eyeglasses.
Yeah, that's a cool story for sure.
Now here's one thing I've noticed, and maybe it's just me, but you're a fellow optometrist, a fellow eye doctor, but we've got some flower arrangements. Unlike you, we need fake flowers for 6 months of the year. So I've got some blue flowers next to some purple flowers, and purple, of course, really is just blue with some red in it. And for some folks who can't really see red, those blue and purple flowers look the same. They put the glasses on, all of a sudden they can see purple, and they'll actually call it purple. And for me, I'm like, okay, you've never seen purple before. How the heck do you know that's purple? So, I think there's a lot we still don't know, but for me, that's always been interesting. How can you name colors that you've never seen before?
Yeah, it's fascinating. I think it's really been an exciting and interesting experience. The other thing I've noticed just working with these patients is that everybody comes in with slightly different things that irritate them, or they have different goals. No two people are the same. So I think it's very important for them to come in and try them personally. Everybody has a different story and has different lifestyles and different goals.
Yeah. Oh, yeah. No, and I like, patients will often tell their story on social media. A couple days later, maybe they'll post on Facebook about these new EnChroma glasses that they've got, and they'll tag our office most times because that's where they got the glasses from.
Right. Yes.
So it's really fun to read what they talk about. It could be, how overwhelmed they were. They saw, how vivid the red cars on the road look like on the drive home. They stopped at the grocery store, and they didn't have to ask somebody, okay, can you tell me which is the red pepper and the green pepper? Because to them, they always look the same. Bananas don't look all, rotten anymore. You can see the yellow. Peanut butter looks brown, not green. So it's really neat to see them document their first couple days after having the EnChroma eyewear. And then just to see how happy their friends and family are for them. Like, they'll get, 40, 50 likes. They'll have all these comments like, I'm so happy for you. And everyone's really emotional. Like, they're so happy that this person, gets some of the color world back, I guess. So that's been super, super cool, is just to kind of sit back and just read the stories that people are posting and how it's affected their lives, because it's 1 in 12 males have a color vision problem. So everyone knows somebody who has a color vision problem. So there's lots of folks out there who can benefit from this. So I think, helping spread the word about this exciting technology is great.
Well, Jeff, I appreciate you taking your time to help us out. Do you have any other thoughts? Anything else you want to share before we go?
No, well, I guess maybe just managing people's expectation. Like, this does not cure color blindness. You can't all of a sudden, pass the test to become a police officer.
Yeah, right.
That being said, there's still huge benefits in this product, in the sense that improves your color fidelity, your color palette expands. So, but that, and we do tell patients that, and they're fine with that. They know that. But the funny thing is, and you probably find this, they all want to take the color vision test again.
Yeah, you're exactly
when
right.
They put the glasses on, every single one, even though we tell them you're not going to pass the test, they all want to take it.
So, Jeff, I really want to thank you for your time and sharing your experience and your expertise. That's been really wonderful.
Sure.
And thanks to all of our patients and listeners. We'll post some information about EnChroma on the website in the show notes, so you can follow that online. There's information. There's an online color vision test that you can take. There's different things that you can do. As always, if you have any questions, comments, or suggestions about our podcast, you can email us at office@brighteyestampa.com. Until next time, this is Dr. Nate. Thanks for listening.
Brought to you by Bright Eyes Family Vision Care and Bright Eyes Kids. Find previous episodes and more detailed information at brighteyestampa.com. Creative Commons copyright attribution, non-commercial use. The only purpose of this podcast is to educate and to inform. It is no substitute for professional care by a doctor experienced in the area you require. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Please consult your physician for diagnosis and treatment.